C-peptide is a byproduct of the pancreas which releases into the body when it makes insulin. The pancreas produces about the same amount of insulin and C-peptide. Insulin is a hormone that regulates the amount of glucose in the body, and glucose is the body's main source of energy. Insulin allows cells in the muscles, fat, and liver to absorb glucose to be used as energy. Because C peptide is a byproduct of insulin production, this test can reveal how much insulin the body is producing. When people take insulin, their bodies don't make or release C peptide. This, ten- this test can tell the difference between insulin made by body, which is endogenous, and insulin from medication, which is exogenous. A C-peptide test cannot determine whether a person has diabetes. It merely indicates if your body has ability to make its own insulin from your pancreas. To diagnose diabetes, a healthcare provider must order a blood glucose test or a HbA1c test. So what is the purpose of C-peptide test? It confirms that diabetes treatments are working effectively, and it determines whether you are producing enough insulin or whether you need insulin injections, or a pump. A normal result of a C-peptide test ranges from zero point 0.5 nanogram per milliliter to 2.0 nanogram per milliliter or 0.17 to 0.83 nanomole per liter. These values may differ slightly from lab to lab. A low level of C peptide may be considered normal if your blood sugar is low and you haven't eaten recently. It can also mean that your body is not making enough insulin or that you are taking insulin injections. This can be related to one of the following medical conditions, especially if you have high blood sugar: type 1 diabetes, type 2 diabetes, if your pancreas is no longer producing insulin. Low C peptide also may indicate that diabetes treatment is not working well enough. Other medical conditions that can cause low C peptide with low blood sugar level include Addison's disease, liver disease, and insulin administered by injection or exogenous insulin. A high level of C-peptide means that your body is making too much insulin. That can point to one of the following medical conditions: Cushing syndrome, when your body produces too much of hormone cortisol; insulin resistance; low level of potassium in blood, like hypokalemia; type 2 diabetes; and pancreatic tumor, like insulinoma or kidney failure. If the test reveals no C peptide, then you need insulin replacement, usually in the form of insulin injections or possibly an insulin pump. Hope you will find this video useful. Thank you and bye for now. Hope you